Dear viewers, steroid use in various critical care conditions has long been a subject matter of debate. In my previous video on steroid use, I discussed the use of steroid in patients with pneumonia. Here I am going to discuss its use in patients with acute bacterial meningitis based on the most recent guidelines. Welcome to Essentials of Acute Care. I am Dr. Sunil Garg. The indications and treatment regime for glucocorticoids are not same in resource abundant and resource limited settings. In resource abundant settings, adjunctive dexamethasone is recommended as part of an empiric antibiotic therapy for adults with suspected community acquired bacterial meningitis. But the role of adjunctive dexamethasone in patients with suspected bacterial meningitis in resource limited setting is controversial. In terms of timing of steroid administration in acute bacterial meningitis, guideline recommends that dexamethasone should be initiated shortly before or at the same time as the first dose of antibiotic. The recommended dosing is 0.15 mg per kg intravenously every 6 hours and it should be continued for 4 days. In resource limited settings, based on currently available evidence, guidelines suggest that it is reasonable to empirically administer adjunctive dexamethasone in patients if there is high suspicion for or evidence of acute bacterial meningitis until microbiological results are available, if there is no delay in patient presentation and there is no contraindication to steroid therapy. So to summarize, steroid use in acute bacterial meningitis, it is recommended in all cases of acute community acquired bacterial meningitis in resource abundant setting. Regarding its use in patients with the resource limited settings, the current guideline recommends that it is reasonable to consider its use in appropriate clinical setting until microbiologic results are available. Here I finish my presentation and thanks for watching this video. Please do not forget to subscribe to this channel. Till then, bye.